Everyone happy? Rightio. So what we'll do is go through the COVID numbers, then we'll do heat health, and then I'll come back to COVID, given our friends here. So there are currently 40 active cases in Victoria with one new case. That case is a hotel quarantine worker, hotel quarantine case rather, and in fact a international airline crew. So Victoria's system of testing early and testing often the international airline crews has been successful in identifying this case. There were 28,337 tests reported yesterday, bringing our total to 4,116,496 tests during the course of the pandemic. But what I am here today with our friends from Ambulance Victoria and KidSafe is to talk about the fact that summer is always a risky time when it comes to staying safe in the heat. And it's a very, very significant issue that we protect each other and we protect ourselves when it comes to the heat. And the message is to stay safe in the heat and do not leave kids in cars. Last year, Ambulance Victoria responded to 1,410 call-outs for people being locked in cars. Overwhelmingly, that was young children under the age of 3. Last month alone, there were 144 call-outs for Ambulance Victoria for people, nearly always kids or infants, left in cars. That is not acceptable. It is dangerous, and as we've seen sadly this summer in other jurisdictions, it kills. And we need to make sure that we protect each other, and we particularly protect those who are vulnerable from heat in cars. Cars heat up very, very quickly in summer, and young people, the elderly, and others are particularly at risk. So there are sensible steps that we can take in making sure that we protect people from the heat. And just 4 of those. Firstly, drink lots of water. It's simple and it keeps you cool as the weather heats up. Stay cool. Search out places that are cool. Plan ahead your day to avoid the hot part of the day. If you're exercising, exercise at the cooler parts of the day. And make sure that you always check on those most at risk. And as particularly the elderly, the young, and those with medical conditions that can be exacerbated by the heat. As the weather will heat up over the coming days and weeks and months, we need to practice these COVID-safe methods of staying cool as well. We need to make sure that in this time of COVID, we think about not just being COVID safe when we go out, taking our masks, keeping social distancing, exercising good etiquette, coughing in the crotch of our arm, but we also need to make sure that we stay safe in the heat while we're doing that. So just plan ahead. Think about when you're getting out of the cars. Think about those kids that are at risk, the pets that are at risk, the elderly that are at risk, and take the steps appropriately to plan ahead, stay cool and stay safe. Look after yourself, look after your family, and look after the wider community. I might ask our friends from Ambulance Victoria and KidSafe Victoria just to add a bit to that message as well before we return to other issues.
Thank you, Minister. Hello, my name is Justin Dunlop and I'm the Director of Emergency Management with Ambulance Victoria. So it's summer again, it's a beautiful day today and it's going to be a hot weekend and coming into a hot week next week. Summer's always busy for ambulance, and last year over summer we attended 114,000 calls across Victoria. Almost half of those, 56,000 calls, were for those in immediate life threat. So it's really important this summer that everybody heeds the message to take care, look after your health, look after your friends and look after your family. So it's going to be hot soon, and so there's some messages around heat that's really important. The first thing is you do need to look after those that are vulnerable, the very young and the very old, and those that have got pre-existing medical conditions. So when it's going to be a hot day, you do need to plan ahead. You need to plan to stay in the cool during the peak of the heat, and you need to plan to take water with you and keep hydrated all through the day. We also need to plan our travels. It's unacceptable to leave a kid or a pet or an older person locked in a car. Sadly, last summer, we attended 528 kids that were left in vehicles in the heat. Now, fortunately, a lot of those were accidental and the parents were nearby, but it still took time to get those children out into safety. So please look in your car before you lock it. Please don't leave pets, children, the elderly, any vulnerable person that can't care for themselves in a car. So this summer's going to be busy, and we expect this weekend to be busy. So it is important to remember that 000 is for emergencies. If you have another health concern, but it's not an emergency, contact your GP or ring Nurse on Call on 1300 60 60 24, or go and visit the pharmacist and get some advice from them. 000 saves lives. In an emergency, ring 000, but in other cases, consult medical practitioners or pharmacists. So when you ring 000 for an emergency, it is possible, if you've got a non-emergency call, that you'll speak to a triage practitioner, and you might find that instead of sending an ambulance, we'll provide you with advice or some alternative service. So be prepared for that, particularly if you're ringing 000 and it's not an emergency. So stay safe this summer. Remember to plan ahead, stay hydrated, and never leave kids in cars.
Good afternoon, everybody. My name's Erica Edmonds and I'm President with Kids Safe Victoria. Completely agree with and reiterate the messages that you've just heard, but from our perspective, our focus is on the safety of children. And on a day like today, the temperature inside a locked car can increase by 20 to 30 degrees more than the outside temperature. Those temperature increases occur most rapidly in the first 5 minutes. Most of the time with children being locked in cars in Victoria, it's an unintentional incident. But if you think of going to the shop, it's only going to take me a couple of minutes. I'll just get the milk, I'll just get the bread. It won't take me long to pay for that petrol. Generally takes 3 to 5 minutes. That's the time at which the temperature inside that car is increasing. On a day like today, it could get up to 60 degrees centigrade in that car. Sure. So our message to parents and carers in Victoria on warm summer's day like this, but also when it's overcast, is very, very simple. Please look before you lock the car, and please never, ever leave a child unattended in a car. Thanks.
Thanks, Erica.
Pleasure.
And Justin, so did we want to deal with those issues, or do you want to move on to other things? We'll move on to other things. So if I could perhaps just briefly address some of the matters relating to the outcomes of National Cabinet and related issues. So Victoria is very pleased that National Cabinet adopted the Victorian plan for how to respond particularly to quarantine upgrades, to deal with hotel quarantine measures and the issues about pre-flight testing and other arrangements. We think this is that extra level of risk assurance that will provide that further level of responding to the ever-evolving threats that we are seeing from the COVID variants as they change around the world. We're very, very pleased that National Cabinet has come together on that. And we're also pleased that National Cabinet adopted the recommendations of AHPPC when it comes to the issues of how we both test and respond to issues surrounding infectivity of the changing virus in hotel quarantine settings. And just to address the issues that the Queensland Chief Health Officer addressed earlier today, when a woman who landed in Melbourne, but a Queensland resident, returned a positive test, as it turned out, with one of the new UK variants, tested in Melbourne, quarantined in Melbourne, followed the established AHPPC National Cabinet's processes around quarantining, being cleared of symptoms, and then being released as per AHPPC arrangements, has gone home and out of an abundance of caution now, as a result of AHPPC and National Cabinet determinations, now up to I think about day 15 of her having tested positive, now being retested out of an abundance of caution, and we are cooperating with our friends from Queensland to make sure that that abundance of caution principle, which we all support, is run down. I should also take this as an opportunity to update Victorians that as a result of the National Cabinet decision, given that we had essentially proposed it, Victoria had already operationalised that system of putting in place the changed protocols for further tests and further times for dealing with particularly these new variants, which I see have also now, the South African variant has been detected in New South Wales hotel quarantine. So I'm very pleased that AHPPC has adapted the Victorian plan, made it a national position adopted by National Cabinet, and we're already seeing its benefits roll out. So either myself, Justine and the crew here are more than happy to take questions.
So Martin, that lady was in quarantine in Melbourne for 10 days, is that correct?
She was in quarantine in Victorian hotels for 10 days, tested on day 1, returned positive that next day, and through the processes of checking symptoms, was released in accordance with those to go home on the end of that, with at least 3 days of being asymptomatic from any symptoms. That system has now changed as a result of Victoria's advocacy, and I'm very pleased that Victoria has now actually for a few days now, prior to AHPPC's decision and National Cabinet's decision, put that system in place.
Why only 10 though? Most people expect to be in there for 14 days, don't they?
Well, that is was the AHPPC national system that all jurisdictions applied, and now as a result of the changing nature of the infectivity of new and emerging strains, out of an abundance of caution, that system has been toughened, and that's a decision that we've both implemented and welcomed.
So,
as our friends from Queensland have pointed out, that was totally in line with both Australian, national and indeed international standards and protocols, but we want to make sure that we take every step to make sure that we are as cautious as possible as the nature of this virus evolves, that our response evolves. I was very pleased that the Prime Minister put in place a Commonwealth hotspot declaration for those zones in the 5 local government areas in Queensland around Brisbane, and as a result of that and other decisions AHPPC have taken, we've implemented the national decision.
Now, is this the first time we've detected the UK strain in Victoria? Granted it was hotel quarantine, but is it the first time?
I know we've had a number of detections of the UK variant in hotel quarantine, and I think if you check over the last couple of weeks the Chief Health Officer's daily updates, you'll find reference to that on a number of occasions.
This is the first time it's been outside of the system though, outside of hotel quarantine.
In terms of it was detected in hotel quarantine, the first case of community transmission of the UK variant was in fact the Queensland cleaner, but the reassuring news there is that the source was clear from the hotel quarantine system, and day 1 into their 3-day quick lockdown, still no further positive cases, so okay. That's a very good start.
So the flight that this lady took from Melbourne to Brisbane, is that an exposure site?
No, I don't believe so, because the person wasn't infectious, And however, out of an abundance of caution, as Dr. Young, the Chief Health Officer of Queensland, has pointed out, now that the person is up to day 15 and has shown no signs of infectivity, but out of an abundance of caution, we're cooperating with them to make sure that all the data they need, together with the manifests, I think, from a Jetstar flight, is all been provided and followed up. So I commend Queensland for their extraordinarily thorough approach to this, to make sure that every avenue is being run down to make sure that Queenslanders and indeed all Australians are safe. Because of course a issue anywhere in any state is an issue for all Australians.
Do you know when this woman's genomic sequencing was done and when the results were provided?
I don't have that to hand, but genomic sequencing is done as a matter of course, and if we can provide further information to that, we certainly will do so.
Was she the first traveller to have left hotel quarantine early after 10 days instead of serving the full 14 days?
No, indeed not. It's been the case for many months right around the nation that all hotel quarantining arrangements follow this AHPPC protocol, and the protocol in Melbourne was no different to the protocols in Sydney, Brisbane, Adelaide or Perth, and now I think Hobart and the Northern Territory.
So Victorians who've been quarantining here at hotel quarantine have left before that 14-day mandatory quarantine time?
It varies in the circumstances. The 14-day model is based around both 14 days and showing, in some cases, no signs of infectivity for a minimum of 3 days. That is now being changed as a result of AHPPC's recommendations and National Cabinet's decision, and Victoria has put in place that operational change, as indeed all other states are in the process of doing.
So then why did negative case, people who come in and test negative, why do they have to stay into quarantine for 14 days if they show no symptoms and are negative that?
In terms of how it recommends in AHPPC advice, there's a very different set of circumstances in, say, home quarantining as opposed to a medical hotel model where there is 24/7 medical support from COVID Quarantine Victoria's support staff. And in accordance with that previous system, this person and many others right around the country have been dealt with in accordance with that, show no signs post their initial positive test, well past their infectivity period, and are released in accordance with that.
Well, with people in Queensland, there's a lot of stress obviously with people that are in Queensland. We understand if you're in the greater Brisbane area, you can't come home for 3 days. But people holidaying elsewhere, they've been encouraged to come home. Are they able to transit through Brisbane? Or what is your advice for people elsewhere in Queensland, Victorians elsewhere in Queensland? Should they come home? And if so, how the hell do they do that?
Well, my advice is the Prime Minister's advice from yesterday. This is a Commonwealth lockdown supported the Queensland government. So the Prime Minister and National Cabinet yesterday backed the Queensland decision that if you are in those 5 local government areas, stay where you are, do not move for 3 days, and if you are in the rest of Australia, including the rest of Queensland, do not go into those other areas. So if you are in Queensland outside of those areas, then you've still got every ability, as far as Victoria is concerned, to come home in the normal arrangements. Coolangatta, Townsville, Cairns, all of those airports aren't covered by this arrangement. So we need to make sure that the Prime Minister's edict is clearly understood by everyone. If you're in those 5 local government areas, do not leave, follow the rules, and if you're in the rest of Queensland, do not enter those 5 local government areas.
So you can't go through Brisbane Airport?
You shouldn't go to Brisbane Airport from, say, I don't know Brisbane that well, from outside of Brisbane, but as I understand it, it is more than okay if you're transiting. I'm not sure there's that many transiting flights at the moment as a result of those changes that have happened. I understand there's been quite a number of flight cancellations out of Brisbane, which seems reasonable in the circumstances. But if you're coming from Cairns, then you don't have to not stop in Brisbane. I don't know if that's a thing, but transiting at the airport is not covered by that arrangement.
A number of flights that were still arriving from Brisbane today. I spoke to a couple of travellers that got off the flight from Brisbane. They said they were in Brisbane and they've now flown into Victoria. When they got to the airport, they had their IDs checked, but that was it. They weren't told they needed to go home and self-isolate until Monday. How do you account for that?
So my advice is that flights, whether it be from the 5 local government areas, particularly that's Brisbane Airport, are being met by authorised officers and representatives of DHHS and other agencies, and are being advised as per the now applicable orders that are now in place arising from National Cabinet. That is, go home, get tested and stay at home until 6 p.m. on Monday, when further advice will be provided. That was the outcome of National Cabinet, and I know from personal experience, people I know, that precisely has been what has been happening at Melbourne Airport both today.
So what about travelling to people in Melbourne now, Victorians? A lot of people have got plans to travel to Queensland and beyond Brisbane. So what should they do if they're supposed to be going like the next couple of days?
So as we've established throughout this pandemic, this virus does not respect state borders. It does not respect holiday periods, and it creates a real havoc with the best laid plans of Victorians and Australians when it comes to holiday periods. The Prime Minister made it very clear yesterday, as an outcome of National Cabinet's decision, backing the Queensland decision. Do not go to those 5 local government areas between now and 6 p.m. Monday, when further updates will be provided. That is in everyone's interests. So I'm sure no one wants to see their travel plans delayed or their personal plans disrupted. Families, all sorts of issues are being disrupted through this pandemic. But the Queensland Government, backed by the Prime Minister, have made it really clear. A short, sharp 3-day lockdown to deal with these issues, so as to allow their contact tracing team to get on top of it and beat it early. So both the restrictions and the measures they're taking for testing are ones that we support, and we want to back in our Queensland colleagues by just calling upon Victorians to follow the Prime Minister's advice, to follow the orders, and please don't go to Brisbane for the next 2 days.
Does the Victorian government and other Australian governments need to work better with airlines to coordinate these sort of things? Because some of the passengers on the plane said that even the airline staff couldn't tell them what they need to do when they got to Melbourne.
So we work certainly in Victoria closely with Melbourne Airport, Avalon Airport and other airports and the airlines. I've had a number of discussions with the airlines myself this week to seek to make sure that there's a closest cooperation as possible in this regard.
But clearly there's a communication breakdown even today.
Well, I think Melbourne Airport have run loops through their PA system as to what the measures are. Victoria has DHHS authorised officers, nursing staff and other professionals out at the airport meeting flights to make sure that this message is got through. We need to make sure that if for whatever reason you've come to Melbourne from those local government areas in Brisbane, the first thing is you've actually breached the Queensland Chief Health Officer's orders. In reality, you should not have been on that flight if you were from those, I think 5 local government areas in fact. And that's an issue for the Queensland Government and for authorities at the Queensland end of that airport arrival system. But if you do make it, then follow the Prime Minister's advice and now follow the Victorian orders. Get tested, go home, stay isolated until you get your hopefully negative result, which overwhelmingly they have been. They have totally been. There's been no further cases as I've been advised. And wait further advice from 6 p.m. this coming Monday, which is the Queensland Government's and the National Cabinet's position.
What would your advice be to anyone who was on that flight, JQ507, with the woman who has since tested positive to the UK strain, even though it is a low positive test?
Oh, look,
what would your advice be to them?
So just on that, she's tested positive but she's not infectious, is the advice from the Queensland Chief Public Health Officer. And Dr. Young made it clear, as we know from Victorian experience, that you can continue to shed virus, that is be positive, for up to 120 days after you're no longer infectious. So as Dr. Young has made it clear, out of an abundance of caution, the Queensland Government is seeking to get in contact with those people and just to be out of an abundance of caution, get checked and make sure that you are not at any risk. And that is a very sensible position, which I would urge anyone on that flight I would urge anyone on that flight to cooperate with the Queensland Public Health Authorities.
So it sounds like, as the Health Minister, you're not stressing about this case.
Look, I give every case that the public health team tell me is a matter of concern right around the country, the emphasis that it requires. And the public health advice that Dr. Young in Queensland, supported by the public health advice here in Victoria, is that you should cooperate fully with the requests and in some places the directions of the public health team. So if you're on that flight, please do as the Queensland health authorities have asked you to do.
Going back to the people coming in from Brisbane, what are the exemptions that are being allowed for people in that Brisbane area to be allowed to come into Melbourne?
Well, the first point is that you should not be coming into Melbourne from those 5 local government areas. You are breaching the Queensland health directions. And you are, if you get here, notionally in breach of the Victorian health directions, which as a result of National Cabinet are backing in those directions. If you are here, then you will be required to isolate and test quickly. In terms of exemptions, there's all the normal exemption processes which you are required to do before you arrive. That is health, that is emergency services, end-of-life circumstances and other arrangements. All of these are readily available on the DHHS and Services Vic website and are being processed as they come.
Given these mutant strains, is genomic sequencing now being done on all people, all return travellers who test positive?
Could you speak up a bit?
Sorry. given these mutant strains from the UK and South Africa, is genomic sequencing being done on all return travellers after they test positive?
Genomic sequencing is done as a matter of course in quarantine hotels, Victoria's hotel system. So if you test positive in those circumstances, you are followed up with the sequencing process. So whether it's any of the new variants or anything else, that is the detective work that is needed to give effect to the kind of enforcement provisions of the AHPPC standards, which have now changed as a result of the National Cabinet decision yesterday.
So those that are in quarantine, like for example now, they will have to serve...
Well, actually, since the 6th of January was when Victoria, having proposed this change, we put in place those changes from the 6th of January here in Victoria.
And how long do they have to be in? So how long do they have to be in?
14 days.
And so up until then, it wasn't 14-day mandatory quarantine. It was once you're cleared, you can leave.
No, once you've got your 3 days minimum from infectivity and symptoms, but that could vary depending when that happened from when you tested positive. It could be, as it was in this instance, 10 days. It could be 11, 12, 13, 14, indeed beyond.
Another 0 day here in Melbourne. When are you going to look at reassessing masks being worn inside, things like that?
Look, I think Victorians know that wearing masks is an important part of the armoury that we bring to beating this virus. I'm really pleased that National Cabinet has endorsed the wearing of masks on domestic flights. I'm really pleased that Queensland, as part of their response, have mandated mask wearing. I'm really pleased that New South Wales has recently introduced mask wearing as part of their response. As we've seen around the globe, let alone here in Victoria, mask wearing as part of a system of keeping social distance, hand hygiene, following the rules keeps us safe. It's not the only thing, whether it's hotel quarantine measures, testing the workforce there daily, responding to variants as they apply. I think masks are going to be with us for as long as the public health advice tells us that's necessary, and the public health advice as we stand here today, given the change of transmission, particularly in New South Wales, is that masks are an important part of our defence.
To make sure I'm understanding you correctly, so before the 6th of January you had to do at least 10 days hotel quarantine,
Well,
and now it's at least 14.
yes, but it's more complicated than that. It's 10 days, well, it was 3, you get tested, you return a positive, you go into hotel quarantining, hospital hotel. Then, depending on what your infectivity levels are and your symptom levels are, you are then released in accordance with that medical advice as approved from AHPPC. In this case, it was, each case is determined on its merits. This case, it was 10 days. In other cases, it can be substantially longer.
Could you understand that some Victorians will be confused about this situation, because we've heard all last year that you had to do 14 days of mandatory hotel quarantine, and now it seems that the timeline has changed.
Oh no, I don't think that's right. This has been a nationally consistent approach from AHPPC standards for the best part of the last year, and it's based on the best public health advice supported by all states and jurisdictions, and as Dr. Young has pointed out today, Queensland have responded out of an abundance of caution, noting in fact that the case in point here is now I think some 15 days without symptoms. So I would urge anyone caught up on that particular flight to cooperate with the Queensland authorities out of an abundance of caution, get tested and provide both yourself and your fellow Queenslanders the assurances that they're looking for.
So those arrangements that we've been talking about, that's in relation to somebody who tests positive, goes into a hot hotel, a hospital, a medical hotel if you like. But if you're in just a regular quarantine hotel, that's 14 days straight, right?
Correct.
And no ifs, buts or maybes about that one?
Correct.
Okay.
All good?
Right.
Now we've got a very cute baby over here who's been the subject of advice from Ambulance Victoria.
Yeah, of course.
I'm going to take...
Thanks, Mister. No worries.
Yeah.